I hope you are fine. I am also in good condition. Welcome to my channel Ateeq Dental Care English. Today we will discuss regarding the root canal treatment process. The main cause of dental pain or toothache is dental caries. Initially, the tooth decay remains in the outer surface of enamel of the teeth, but with the passage of time, the second layer of teeth, which is called as dentine, is involved, which is very sensitive layer, and ultimately the bacteria reach the pulp of the tooth or soft tissues of the teeth, which results in severe pain in the teeth, which referred or radiates to head area, ear area, and neck area. Patient present to us with hand over their face and they are unable to locate the offending tooth. The pain of the tooth suffering from pulpitis, the inflammation of the inner mass of the tooth is very severe. Patient is unable to sleep at night time, and when he try to lie down, there will be start of severe pain. So it's very difficult to survive with toothache. When the patient suffered from such type of severe pain, then there are only two options we offered to them. One is root canal treatment to save or preserve the precious tooth structure, which is a gift from the nature to us, and second option is tooth extraction, which is least desirable option. So what will we do during the root canal treatment process? The first step of root canal treatment is anesthesia. Local anesthesia, infiltration or nerve block is the first step of patient treatment. Second step in the root canal treatment is removal of decayed portion of the teeth. The tooth portion that is already decayed by dental caries must be removed in order to convert it into a sound solid structure. Third option is to remove the pulp soft tissue with the help of suitable files, and the process is called as pulpectomy. After removal of the soft tissue pulp, we irrigate well in the canal system with the help of sodium hypochlorite, which is a household bleach. After copious irrigation with sodium hypochlorite, a thorough washing we achieved, and after that we dry the entire canal system, and if there is underlying infection in the root portion, then we place a suitable medicament like calcium hydroxide, which is very old and still in use and the agent of choice. After placing calcium hydroxide, we seal the excess cavity of the tooth with a temporary filling like cavit and recall the patient after 7 to 14 days. In next visit, when patient came to us with a comfortable condition, we remove the old filling and thoroughly irrigate the canal system with the help of sodium hypochlorite, flushing out all the irritants and medicaments in the root canal system, and then dry the entire root canal system. After drying, if the patient is pain free and there is no infection, no exudates coming out from the root canal system, the entire root canal system is dry and pain free, then next step is filling of the root canal, which is called as obturation, filling of the empty space. We place suitable gutta percha points which are just like a rubber and are inert and compatible with the body tissues. We place in the root canal system and shear them off at the pulp chamber level. After filling the root canal system with the help of gutta percha points in the remaining chamber or upper part of crown portion, we fill with the suitable filling material like tooth colored material of composite filling, and in future we need a cuspal coverage. Cusps are important points of the teeth which help with mastication and chewing process. So in order to protect the cuspal area, we have to place a suitable crown or cap over the teeth, or sometime more conservative onlays or overlays over the tooth structure in order to convert them into a protective system or zone. After crowning of the root canal treated tooth, the patient will easily eat from that side and is pain free and enjoy the process of mastication. So it's very important and very desirable process of root canal treatment. Important thing is we have to highlight the one important myth regarding the root canal process. Some persons call this process a dead tooth, while the blood supply of the tooth from the peripheral sides, from the surrounding of the tooth remains intact, from the gingival gum tissue, from the bone, from the periodontal ligament, the surrounding supply of the tooth remain intact. So in real, this term is not correct as the tooth supply is intact from the peripheral side. We only remove the central core of the pulp of the tooth while the all other structures are intact and contributing to the nutrition of the tooth. So hopefully this video will be informative to you. If any question related to the steps or process of root canal treatment, you can ask in the comment box, and kindly subscribe the channel and like it and share it so that further information will be delivered to you. Thank you.